Hi, welcome to Dr. Medics. Anatomy of male reproductive system. Prostate, which is the last internal organ of the male reproductive system. Prostate is an accessory gland of male reproductive system. Secretion of gland add bulk to the seminal fluid along with those of the seminal vesicles and the bulbourethral glands. Prostate is firm in consistency due to the presence of dense fibromuscular stroma in which the glandular elements are embedded. In females, prostate is represented by paraurethral gland of skin. Situation: prostate lies below the urinary bladder and lies in the lesser pelvis and behind the lower part of the pubic symphysis and upper part of the pubic arch, and lies in front of the ampulla. Zones of prostate. According to McNeil, there are three zones: peripheral zone, central zone, and transition zone. Peripheral zone is the first zone, which is 70% forms the glandular tissue and situated posteriorly and vulnerable to cancer. Second one is the central zone, which is 25% of glandular tissue situated posteriorly to urethral lumen and above ejaculatory duct. Central zone is not involved in disease and is of Wolffian duct origin. Periurethral transition zone or is also known as transition zone, which is 5% of glandular tissue, and benign prostate hypertrophy arises from this zone, and central and transition zone constitute central gland. Sphincters related to prostate. In pre-prostatic part of urethra, external urethral sphincter is present, which has a mechanism subserves the sexual function of closing during the ejaculation. If this sphincter gets resected, retrograde ejaculation occurs. Distal urethral sphincter mechanism seen at the junction of prostatic and membranous part of the urethra. It is horseshoe-shaped with most of the bulk lying anteriorly. It is distinct from muscle of pelvic floor. Lobes of the prostate. Prostate has 5 lobes, that is, one anterior, one posterior, one median, and 2 lateral. As of now, glandular tissue is divided into 3 lobes, 2 lateral and 1 median. Capsules and ligaments of prostate. True capsule and false capsule. True capsule formed by condensation of peripheral part of the gland, fibromuscular in structure and continuous with stroma of gland. Venous plexus lies between the true and false capsule. False capsule lies outside the true capsule and derived from endopelvic fascia. Anteriorly continuous with puboprostatic ligaments. On each side, prostatic venous plexus embedded in between the false and true capsules. Posteriorly avascular and formed by rectovesical fascia of Denain-Villiers. A pair of medial and lateral puboprostatic ligaments extend from the false capsule to the back of pubic bone. Medial lies near apex, while lateral close to the base. These four ligaments support the gland. Structures within the prostate. There are three structures: prostatic urethra, prostatic utricle, ejaculatory duct. First one is the prostatic urethra. Transfers the gland vertically at junction of its anterior one-third with the posterior two-third. The second structure is the prostatic utricle. Blind sac directed upwards and backwards. It opens at the middle of urethral crust. Third one is the ejaculatory duct. Passes down and forwards and opens to prostatic urethra on each side of the opening of the prostatic utricle. Structural zones of prostate. Histological section of prostate do not show the lobar pattern of the organ. Instead, there are two well-defined concentric zones, separated by an ill-defined irregular capsule. Zones are absent anteriorly. There are outer larger zone and inner smaller zone. Outer larger zone composed of larger branched glands, ducts of which curve backwards and open mainly into the prostatic sinus. Frequent site for cancer. Inner smaller zone composed of submucosal glands opening into prostatic sinuses and group of short simple mucosal glands surrounding the upper part of the urethra, prone to the benign prostate hypertrophy. Blood supply of prostate. Prostate is supplied by branches from inferior vesicle, middle rectal and internal pudendal artery. Branches of these arteries form larger outer subcapsular plexus and small inner or periurethral plexus. Greater part of gland is supplied by subcapsular plexus. Veins of the prostate. Veins form rich plexus around the sides and base of the gland. Plexus communicates with vesical plexus and with internal pudendal veins, which drains into the vesicle and internal iliac veins. Valvulus communications exist between the prostatic and vertebral venous plexus, through which the prostatic cancer can spread to vertebral column and to the skull. Lymphatic drainage of prostate. Lymph from the prostate drain chiefly into internal iliac and sacral nodes and partly into the external iliac nodes. Nerve supply of prostate. Prostatic plexus nerve derived from lower part of the inferior hypogastric plexus. Prostatic plexus contains thick nerves and numerous large ganglia. Also supplies seminal vesicles, corpora cavernosa, corpus spongiosum, membranous and penile parts of urethra, bulbourethral glands. Prostate supplied by both sympathetic and parasympathetic nerves. Prostate contains numerous end organs which impulses from which are relayed to the lower three lumbar and upper sacral segments. Secretion of prostates are produced and discharged after stimulation of both the parasympathetic and sympathetic nerves. Age changes in the prostate. There are five changes. The first one is the at birth. Prostate is small, made up of stroma in which a simple duct system is embedded. During the first 6 weeks at birth, epithelium of ducts and prostatic utricle undergoes hyperplasia and squamous metaplasia under the stimulation of maternal estrogens. Up to 9, changes are negligible. Between 9 to 14, duct system becomes elaborate by formation of side buds and gland slowly increases in size. Second changes at puberty. The male hormones rapidly changes. About 1 year, prostate becomes double its prepubertal size due to rapid growth of follicles and condensation and reduction of stroma. Third changes from 20 to 30 years of age. Marked proliferation of glandular elements with infolding of glandular epithelium into lumen of follicles, making them irregular. Fourth changes is from 30 to 45 years of age. Size of prostate remains constant and involution starts. Epithelium infoldings gradually disappear and amyloid bodies increases in numbers. Fifth change after 45 to 50 years of age. Prostate either enlarged called benign hypertrophy or reduced in size called the senile atrophy or undergo malignant changes. Histology of prostate. Prostate is fibromuscular glandular organ. Stroma comprises collagen fibers and smooth fibers. Columnar epithelium of acini is folded. Lumen may contain small colloid masses called amyloid bodies. Development of prostate. Prostate develops from a series of endodermal buds from the lining of primitive urethra and adjacent portion of urogenital sinus during first 3 months of intrauterine life. Surrounding mesenchyme condenses to form the stroma of gland. Prostatic utricle develops in region of Mullerian tubercle similar to vagina in females. Central zone of glandular tissue is of Wolffian duct system.